My name is Nancy Gowan, and this session is on Focus on Function, Assessing and Documenting Psychosocial Function in the Workplace. Social functioning refers to well-being that may be defined as a state of good mental health, social adaptation, combination of both. Working within the workplace, it's important to understand the functioning of an individual includes not only physical function, but psychosocial function. And we need to consider this within environmental contexts. Talk about function times when we're talking about return to work, we're asking the healthcare provider for restrictions and limitations. That doesn't always help us in determining whether someone can do the job. Most important when we're looking at a return to work process is to focus on what is the employee's function and what does the job require and how can we bring those together for the person to have the capacity to do their job. Medical restrictions and contraindications are important to be able to identify any risks that an employee might have towards recovery. Most important part of restrictions and limitations, focusing on the employee's capacity. What can the employee do today? Their hours, their cognitive skills, conflict management, emotional regulation skills. What kind of skills do they have to be able to implement those within a workplace? Many times we use tolerance to determine that. When we're talking to the employee, we talk about, how tired they might feel or fatigued, or how much stress or how much anxiety they might feel. But tolerance is more subjective, and we need to be able to put those into functional capacity terms. So how does that stress impact that person's ability when they come into the workplace to do their job? It may affect their cognitive skills, how they can pay attention or remember things. And so, as an occupational therapist, we assess capacity for function. What can an employee do? Challenges when it comes to thinking about function, because most people talk about diagnoses, treatment, signs, symptoms, tolerances, and restrictions. As an occupational therapist, we need to translate that into capabilities and functional ability. For example, there might be functional limitations that show up as a result of psychosocial dysfunction. Someone is apathetic or has reduced motivation. How that might apply to work function is we might see a reduced level of activity or productivity in the workplace. Challenges with tasks that have deadlines, pressures, high expectations for productivity. Think about the sign or symptom of having psychomotor retardation or kind of slowed speech, pauses before answering speech with reduced volume or inflection. We might see this in the workplace as having communication difficulties with customers, supervisors, coworkers. The individual might need increased time to complete a task. It leads to a reduced productivity. Be challenges with having good customer contacts, meeting deadlines, time pressures, high expectations for productivity. A sign or symptom might be very fatigued, loss of energy, or sleep problems. Functional capacity in the workplace may show up as reduced activity and productivity, reduced attention and concentration, difficulty again with tasks with deadlines, time pressures. That's where errors might be made due to decreased concentration. If someone has anxiety and they might be brooding or have excessive rumination or feelings of helplessness or worthlessness, This may show up in the workplace as reduced activity and productivity, diminished ability to think, focus, to concentrate. There are personal difficulties with coworkers and managers, and disrupted work relationships, difficulty with teamwork, or even being able to assert themselves. Someone with decreased ability to think or concentrate or make decisions, you might see this in the workplace as having more work errors or injury, productivity, difficulty with multiple tasks, reduced organization or time management skills, difficulty with deadlines again, difficulty with tasks where the error rate is unacceptable, or difficulty with complex activities or multiple activities. One is irritable, aggressive, bursts of anger, or frustrated over minor matters, maybe blaming. That may lead to workplace functional difficulties such as interpersonal difficulties, reduced ability to deal with conflict, or difficulty with tasks with frequent customer contact. When someone has high levels of stress, as a tolerance, that's having too much stress. In a functional capacity perspective, we might see someone having difficulty with complex tasks, reduced ability to deal with conflict, not able to cope with situations that might have higher levels of stress, such as time deadlines, pressures, high expectation for productivity, or multiple complex tasks. So, as an occupational therapist, you want to look at whether someone can stay at work or return to work and objectively assess that. Assessing safety, the person's ability to safely perform their tasks for themselves, for others, for the public, ability to perform those tasks in the environment at the productivity level required, and then trying to determine what strategies that we could put into place to support this individual to stay at work. Performing that functional assessment on the psychosocial side, this would include doing a complex interview with the individual, understanding some of the file medical reports, information about the diagnosis, about the treatment, about the effectiveness of treatment. But then we're going to move to understanding baseline safety testing. Can someone focus for long enough? Really looking at cognitive capabilities to pay attention, to manage their emotion, to be able to make quick judgments. And then performing objective, standardized, and non standardized testing and job specific observations so that we can come to an analysis to determine if this individual is safe to continue on their job. Look at function-based discussions and questions for the employee instead of saying, "Oh, fatigued are you?" on a scale of 0 to 10, which really focuses more on a self-report, a fatigue level. Talk about things that are function-based, problem-solving capabilities, strategies that they've used, tools that they can use to overcome that fatigue or overcome that symptom. It isn't about the symptom, but it is how does that impact your ability to function in the workplace? If you ask about symptoms, you'll get a symptom based discussion. If you ask about activity and function, you'll understand more how those symptoms might impact that person's ability to do their work activities or their work tasks. There are 5 basic questions that you might ask prior to return to work. What is your biggest concern about return to work? What job tasks do you think will be most difficult? And how can you vary those job tasks when you return to work? You'd want to ask about how much help they can expect from supervisors and coworkers and how they might ask for that help. Again, it is function-based, obstacle barrier-based questioning to allow you to focus on what might be the barrier to return to work. Completing social assessment in the workplace, the occupational therapist should be doing some observations. Every moment that you're with that employee, observing them on the job, having a group discussion with their manager and the employee, interviewing and doing some standardized testing, you're looking for all of that information to compile into an analysis of that person's ability to function. For example, if that employee is being interviewed, are they actively engaging in a conversation, communicating with yourself clearly? What is the length of that discussion? How accurate is those answers? Their ability to define their concerns or their ability to follow the conversation? And are their answers consistent over time? As you're having the employee review and interpret a consent form, you're looking for skills such as reading ability, the ability to analyze and reason, the ability to communicate any questions, ask questions. So you're looking at their problem solving and analysis. And the employee is communicating with the manager or a coworker. You want to again look at the length of the discussion, the amount of content they've remembered later. Is their communication consistent? What is their nonverbal skills and their ability to interpret the manager's nonverbal skills? And how do they manage their emotions during that time? When you're providing an employee with instructions on how to do a test, their task instructions, you'll want to pay attention to how many instructions you've given and how long it takes that individual to complete those instructions or how long they can remember those instructions. So you may give instructions on doing a task. You may have a bit of a conversation and then ask them to complete that task. They remember those instructions? Are they able to analyze things while they work through? Can they use information you might have provided prior to be able to work through those tasks? Are they sequencing the tasks in the way that you've instructed them? When the employee is problem solving on strategies or you're telling you about strategies, you're looking at how they might outline a problem. Are they able to identify the pros and cons of type of strategy? Multiple strategies or just one? All of these are observations and analysis that will help you in determining their function. Perhaps you have the opportunity in the job task observation to observe them serving a customer or interacting with coworkers and managers. You want to note their communication skills, their ability to accurately interpret verbal and nonverbal cues, their ability to engage in that problem-solving process, and what the cognitive requirements of the actual task might be, and whether they are able to complete them, and whether they can recognize and manage a customer's emotions. For example, in a call center situation where you might have a angry caller, or in a teller situation where they may be having to problem solve with that customer about what that task should be. Observing them completing the job task, note, do they engage in the task? Do they organize a task? Are they using problem solving and time management strategies? Do they have good temporal awareness of how long it's taking them to complete the task? And can they filter out any environmental stimuli like noise, lighting, activity around them? Are they able to shift from one task to another smoothly? And can they simulate some of the challenges? If there's none present at the time, you might pose some challenges and ask them how they might complete them. Or you might put a challenge in their way in order to see how they problem solve through it. You're also analyzing work behaviors. Are they on time for the assessment? What is their appearance? What is their response to feedback that you might give during the assessment or that the manager might be giving? Are they able to be on time during the task? So, knowing that they have a customer in front of them, they completing that task in a timely way so that they are keeping that customer engaged in that process and completing that according to productivity standards. You may sit with an employee and review their work calendar and their time management system. With that, you're looking for activity levels. How detailed is their reporting? What strategies do they use around managing their time, such as time blocking? Or how do they follow through? Do they use task lists? Do they have routines or processes that might help them on the job? Those on job and interviewing opportunities allow you to take a look at where some challenges might arise. From there, you may decide that you want to do some more detailed assessments to determine what are the barriers to completing those tasks. So, some of the assessments that you might decide to use are things like the psychosocial assessment of the HUDAS, the disability assessment survey. It is a self-report on their level of function. Is used by mental health professionals to take a look at functional levels. With mental health and psychosocial issues, cognition is important, and cognition can be impacted. And so it's important to do at least a cognitive screen, whether that be the brain effects screen or a MOCA. Note that the MOCA is not set for individuals with mental health concerns, but there are a number of areas within the MOCA that will highlight concerns in attention, constructive ability, word finding, attention, and memory. You may also do some safety assessments. So depending on their condition, you might be doing balance, their vision, their hearing, or their gait, assessing that objectively with various tests. You may also want to understand their self-efficacy to be able to determine their readiness for return to work. So there is the return to work self-efficacy scale for mental health that you could utilize. Or understand their ability to manage symptoms with different activities. For people who have hyperarousal, sometimes the SUDS is used as a tool to be able to help that individual to determine what kind of fear hierarchy you might develop in your training around exposure to activities that are anxiety provoking. You also might want to look at job specific obstacles. The ROSES is a good tool to examine obstacles and self efficacy together when we're looking at return to work. Remember, with all of these objective standardized tools, these are assessment tools only. And you need to combine that with all of the analysis that you've done as you've interviewed, as you've observed them on the job, as they've looked at their day-to-day function, and during the testing. So these tests allow you to have some objective information to validate your observations during the other parts of your assessment. When you're documenting psychosocial limitations, ensure that all your documentation is preserving that employee's personal health information. Do not disclose diagnosis or treatment, or even a particular type of healthcare professional. So, including things like a psychiatrist or social worker or mental health professional in the body of the report, in its sense, discloses diagnosis. There's general terms for treatment, so their health condition, or their treatment plans do not include specifics that would help people to determine what type of diagnosis they may have. If someone is distressed, you may want to refer the employee to the Employee Assistance Program. Do not disclose this in the report. You may disclose that you've referred the employee for alternate strategies and tools and resources that are available to them to assist them in managing their health condition. Use functional language to describe your work limitations. Things like challenges with reduced attention, sustained attention for no longer than 10 minutes. So, functional language is the ability to attend for that length of time. It may be because of fatigue, it may be because of memory, it may be because of anxiety, but really the functional language is difficulty with attending for that period of time. Keep your documents objective. Include only the information about work function and abilities, not the perceptions of the employee or the manager. Although these are really important things to gather during your interview and during your assessment, reporting them within the report does not assist in getting recommendations approved. As occupational therapists, we want to keep our assessments and our recommendations objective in order to allow that employee to have the best opportunity to have those recommendations approved. If an employee would prefer a recommendation, but you have objectively determined that that is not required, this should not be included in your objective recommendations. It may be included as the employee would prefer to have this activity or this task done in a different way, but always include whether your objective assessment has validated that or whether that is a preference more than a requirement. When we're looking at that, being able to determine if someone can return to work, realize we're looking at the optimal fit between the work, the worker, and the workplace. So analyzing not just the worker's functional abilities, but the work demands, the cognitive behavioral demands of the job, the environment and the workplace that the person needs to perform that in. In all situations, you want to ensure that as an occupational therapist, you're providing the best optimum objective report and assessment to allow this employee to have the best success in the workplace. If you have any further questions about how to assess an individual with psychosocial concerns or be able to report that, contact your clinical lead or give us a call so that we can support you in having the best opportunity to support that employee.